Hello, my name's Perry Guaglianone. I'm a physician, a medical oncologist at Cancer Care Specialists, and I see patients in Decatur, Illinois, and also in Shelbyville and Clinton. Started my training in California because that's where I grew up. Went to college there, and mostly because of family reasons, and I've been back and forth from Wisconsin and California for most of my training. Working in Wisconsin, I heard about a great place to practice oncology here in Decatur, Illinois, with Dr. Wade, and that's how I ended up here in Central Illinois. I've always been interested in cancer and cancer research. Even in college, I was studying cancer-causing viruses, and I thought that would be an interesting way of understanding how organisms function. It was around that time my father developed cancer. He had a head and neck cancer, and that put a changed my direction made it very real as I could understand the anxiety and the uncertainty associated with cancer as a diagnosis. And that did color my studies over the years, as I've always been directed towards studying cancer even before going to medical school. Things have changed dramatically over the past several years. I can remember a time when we thought bone marrow transplants would be the cure for everything, and bone marrow transplant has its place, but that's using intensive chemotherapy. Now we've been using much milder treatments to accomplish much more. Targeted therapies are becoming more commonly used. Immune therapies are becoming more commonly used. There's been a revolution in cancer treatments in the past several years. I've been involved with cancer research since college. The different versions of research look at more fundamental questions. Here at Cancer Care Specialists, we're involved with clinical trials involving patient treatments. It's a very important part of our practice that we're bringing cutting-edge treatments to central and southern Illinois. Clinical trials are the way we advance our understanding of different treatments. There's a lot of basic research that's being done that bring up different drugs or different treatments, but eventually these things have to be tested in people. And we design clinical trials on a national level. These are committees that are done by doctors from all over the country that look at questions that are very important. Is a particular disease, does it need a treatment at a particular point in time? And so they design a clinical trial to try to determine if there's a new treatment that's available. And so we often present our patients with the option of participating in a clinical trial if the trial is designed for their particular problem. If they fit into the structure of the trial, there may be a treatment that is not otherwise available, and we consider that cutting-edge medicine. Chemotherapy is not the only treatment we have. There's surgery and radiation. When we think about what to expect, we have to define what our goals are. Are we trying to cure this cancer? Is it curable? Or are we trying to stop it from growing and keep it under control? So it's very important to define what our goals are and optimize quality of life. There's been a lot of proud moments in practicing as a medical oncologist. Probably the most dramatic things I've seen are patients who've had very advanced disease and were very ill and might otherwise be thought of as incurable or untreatable, and we've found a treatment, sometimes on study or sometimes with some of the newer medications, and they've had dramatic benefits and dramatic treatments where there's prolongation of their life and improvement of their quality of life.